Hello and welcome to Whitecoat Medicine Talks. My name is Patsy. I'm a speech and language pathologist. Today, let's talk a little bit about Parkinson's disease and how having Parkinson's affects an individual's speech sound production. So, we know that Parkinson's disease is a degenerative, progressive disease that affects muscle movement. When an individual has Parkinson's disease, they will have a speech sound disorder that's called dysarthria. Dysarthria is a speech disorder characterized by muscle weakness. And this muscle weakness significantly impacts speech sound production. There are 4 signs that we'll see in an individual with dysarthria. The first, a very common sign, is slurred speech. Because the individual is dealing with this generalized weakness of the muscles, it definitely affects the lips, the tongue, the palate, jaw, the movement of the facial muscles, of the mouth muscles to produce speech sounds. So this slurred sounding speech pattern you will hear many times with an individual with dysarthria that has Parkinson's disease. This type of slurred speech significantly affects articulation, and again, it is affecting the range of motion. No longer can they produce precise sounds. The clarity of speech begins to slowly go away with this generalized overall muscle weakness. And slurred speech is a very common sign of dysarthria in Parkinson's disease. The second sign is a very soft, low volume type of voice. Again, think about the vocal cords. These are a pair of muscles that produce sound. These muscles are greatly affected by the Parkinson's disease that causes this dysarthria. So the vocal cords are no longer the same, and now the individual has a softer tone, lower volume. Many times they'll sound breathy, a bit raspy, even aphonic. They'll lose their voice sometimes. So you will hear this type of very low, soft voice. A third characteristic of dysarthria is speaking slowly. Again, the strength is gone because of this muscle weakness. Motor coordination, this range of motion, this lack of strength, there is a loss of that rapid movement to produce precise, clear speech. So you'll see an individual with Parkinson's disease speaking slowly. Sometimes, number 4, they'll even speak a bit too fast, but that's because they've lost control of the movement due to this muscle weakness. So these are 4 common signs of dysarthria in an individual with Parkinson's disease. Now let's talk a little bit about how to help a loved one that is dealing with this type of muscle weakness, that is dealing with dysarthria, how you can help yourself if you're dealing with one of these signs and symptoms of dysarthria when having Parkinson's disease. The first one is utilizing slow, easy speech. What does that mean? It means to take time with your speech sounds. So basically, if you have that slurred speech, if you've lost that precision in the ability to produce sounds, that clarity, the articulation, that range of motion, now is the time to focus on the ability to now use slow speech. Focus on slowing down so that you can be better understood. Many times we want to talk fast. We want to say as much as we can. But with dysarthria, it's important to slow down so that you can be better understood. A second technique is to use your speech breathing. So, taking a nice full breath of air before speaking is vital to your ability to continue to have voice when speaking. If you find that you're running out of voice And as you're speaking, you lose your voice. It's because you're not taking a good breath. So take a nice deep breath. Use your speech breathing so that you can have enough air to produce the words, the sentences, and engage in conversation. Many times you'll have to resort to using shorter phrases or simpler words, but you can do this. Just take a deep breath and take it nice and slow. The third one is over-articulation. So, because you no longer have the ability to articulate and have that accurate, precise motor movement of the lips, the tongue, the palate, the jaw movement, now you have to make an extra effort. So over-articulate. You want to open your mouth wider. Make sure that you are moving your tongue when you produce sounds. Take note of the movement of your mouth. Practice in front of a mirror and look at how your mouth is moving. And remember what that feels like so that when you have to over-articulate, you'll make sure to make that extra effort and open your mouth, move your lips. Make sure your tongue is lifting, it's elevating, it's moving side to side, and you're producing sounds a bit better. A fourth way is sometimes having to use another means of communication, not just verbal speech, but perhaps through pictures or writing or drawing. This is called an augmentative device. This type of alternative augmentative device is just another way to communicate without having to use your voice, without having to use your verbal speech. If it becomes too difficult and you're not able to produce the speech sounds clear enough, your speech pathologist can be your guide and your mentor and show you how to use other ways to communicate through pictures or gestures or drawings, sometimes even letters. Be able to produce your own thoughts through writing. There's other ways to be able to communicate, not just having to deal with your verbal speech that has become a struggle and no longer is as effective as you want it to be. So these are the 4 ways that you can help yourself, or if you have a loved one dealing with dysarthria because of their Parkinson's disease, you can show them how to either use their breath properly, help them to over-articulate, to slow down, or perhaps use another way to communicate, not just your voice, but through pictures or writing or drawing. And as a listener, make sure that you're paying attention. As you're listening and speaking and engaging in a conversation with someone that has Parkinson's disease and dealing with dysarthria, you want to make sure to always pay attention, focus, look at their mouth as they're speaking, and make an extra effort to listen and to visualize how they're forming their mouth to produce these sounds. Also, make sure you're in a well-lit area so that you can really see their facial movements. Everything about this individual has slowed down. They have muscle weakness, and this definitely significantly affects their speech pattern. So you want to be able to be ready and focused, paying attention, and listen, and help them if they need that help. I hope this has helped you to help yourself or a loved one that's dealing with Parkinson's disease and dysarthria. I'll see you next time.